Short presentation for you to talk a little bit about our company. But first, a little bit about me. Academically, I've got a master's in biotechnology from the University of Wisconsin and an MBA from the University of Arizona. I have executive training in strategy and innovation from MIT, and I'm also classically trained as a Lean Six Sigma Master Black Belt from ASU, as well as an Intel certification. A little bit about our value proposition and really the problem to be solved. We're dedicated to pursuing groundbreaking biotechnology products with evidence-based research to aid in providing healthful existence forever without limits. And what does that mean tactfully? Really, our vision is just that. It's to become the world's foremost biotechnology firm providing natural solutions to the largest healthcare problems. Our mission to enable said vision is to create products that help support overall health in cancer, viruses, reproduction, skin health, and pain relief. That strategic alignment is to really create products in those 5 major channels. And you can see those products there looking to try and take an opportunity to improve those areas of disease states. It all starts with a beginning story. Infinitum is our flagship product. It's patented. It's got a proprietary mathematical model really supporting cancer and viruses. And it's considered a multivitamin, but we've got a unique extract blend in there as well. We had an opportunity to take it out to the market as considered a supplement, and the FDA doesn't require us to do any testing for that, largely because it's proven safe, and test it out in the market and see what our customers say. Our math seemed to suggest a lot, but we really needed customers and evidence to show it. And then we started getting a trickle of these unique N-of-1 sample stories, these anecdotal stories of what we're seeing. And then it became 20, it became 50, and it became 100, and we were really taken back by some of these. And one of them really stuck out for us. It was a unique case. A gal had polycystic ovarian disease. She had IBD. She had a kidney tumor, gallbladder stones, and was diagnosed to be infertile. After taking Infinitum for 4 months, the polycystic ovarian disease cleared up, the tumor was eliminated, and she was pregnant. Pretty dramatic story for us. That's really when we started saying, you know what, we need to kind of transition our company not to be a supplement company, but really be biotechnology, largely because we bioengineered this product. And we began a formal research program. A couple of our anecdotal stories are on YouTube if you'd like to take a look. We've taken a few of these customers nationally to tell their story. A little bit about the research program that we have. Again, these testimonials have really kind of come broadly and has pushed us from a supplement company to a biotechnology company with a real focused niche on oncology and all the kind of fingerling ecosystem that touches oncology. 2 preclinical studies have been performed with 13 cancer cell lines showing supportive anti-cancer properties. Natural Immune Systems Labs, we've done 4 cancer cell lines with them: glioblastoma, prostate, lung, and melanoma. That study is actually available on our website. It shows statistically estimated reductions in all 4 cancer cell lines. Then Mayo Clinic picked it up with a mouse study, and they did it in 9 different cancer cell lines, showing a reduction in tumor size, cancer cells, as well as metastasis markers. And that is in publication process. With that, Infinitum really kind of bled. We knew that the math worked, and we created new products around it. Infiniderm is our essentially a Infinimin formulation on a topical delivery model. Relief is our new pain reliever, which actually helps complement some of the pain relief our patients do have, or our customers do have. Soap blends, as a lot of folks are using soaps with CBD. We have a dragon roast coffee, which is essentially a unique mushroom blended into the coffee and then infused out in the beans. And then we've also got a liquor whiskey of the gods, as we call it, that's used, same thing as a coffee, a reishi mushroom that's then infused into the whiskey. That's pending liquor license here in Arizona. A little bit about Infinitum. It's a unique blend of extracts. We've got a multivitamin panel that combines 3 seaweed species, 3 mushroom species, and an acai berry. Shows a lot of unique extracts from separate research articles, about 1,400 of them, but never together. And that's essentially where we did our mathematical models. You can go to PubMed, you can ask the researchers for raw data, and you can pull all this stuff together and create your own. It's got a simple, elegant logo and label, and we use good manufacturing practices as our quality designation, and a very simple, memorable tagline, health forever without limits. And the bottom right there, you can kind of see the specific species of seaweed, species of mushrooms, as well as the acai berry that our model picked specifically for some of their clinical relevance. Market space, about 124 billion in this market space. Key leaders are from Pfizer and Bayer. However, there are no known immunosupportive multivitamins on the market. If you ask any other physician, do multivitamins help you? They would laugh and basically tell you they do nothing for you. And that is actually unfortunately true based on what we have out there, but they don't have what we have. Infinitum, again, is like Infinitum, but we use one specific seaweed species that has a lot of topical evidence, and we use one mushroom that has a lot of topical evidence, and also has a unique natural UV sunscreen. And out here in Arizona, having sunscreen every day is actually a pretty important thing. Again, simple, elegant logo, very clean, very unique branding. We get a request to purchase this brand probably once a month. Infinitum really tends to drive a lot of value just from the trademark. Market space is about 27 billion. You see the two key leaders there. Aveeno actually has a really successful celebrity, Jennifer Aniston, that promotes that one. That's been very successful. Relief is patent pending for a natural blend of extracts supporting muscle aches, headaches, and chronic pain. There's one compound in there, specifically incarbilitine, that we found a study illustrating a 1 million compound screen saw that incarbilitine is an analog to morphine, and is also the most potent compound in the world for anti-pain relief or pain relief. It doesn't go down the opioid receptors, it actually goes down the adenosine receptors. We added that to our pain reliever product using white willow bark. Obviously, for those that are aware, it's the original aspirin, fever-free for migraines. And then we got some absorption compounds in it as well, vitamin B12 and magnesium. Market space for us on pain relief is about 114 billion. Two areas for pain relief that are well known: the daily pain relief, ibuprofen, Excedrin, aspirin are the key leaders, and then the key leaders for surgical or post-op are Dilaudid, fentanyl, Vicodin, and then there's a long tail of CBD-related cannabis categories. New products, like we said, are soaps, largely focused on the CBD area, about 250 billion. Our coffees are 188 billion. We are the only coffee in the U.S. with this mushroom infusion. Likewise, with our whiskey, we are the only ones with a reishi-infused whiskey as well. Interesting story about the whiskey is there is an anti-cancer study out of Japan talking about the sipping of this whiskey and the anti-cancer activity in cells. And we've got a study on the website if you're interested. Market space, now our niche specifically is oncology. It's about a 200 billion market space, and it grows 13% year over year. We don't see that reducing at all. Again, the key point here is there are no known immunosupportive products in the market with anti-cancer properties, chemotherapy complements, safe, cheap, and efficacious. And we'll talk a little bit about the chemotherapy complements shortly. A bit of the marketing. Highest return on investment is word of mouth. Our customer testimonials at the end of the day become the dinner table talk, right? At the end of the day, when you go home and you've taken a product that seems to work, you talk to your family, you talk to your friends, and that's the most potent return on investment we have. Research obviously sells itself when it's on the website and we've got the information out there. We talk quite a bit about it. We also have blog articles. We also support professional athletes like Ginger Humer, our professional high diver for Red Bull. And we also have social media, Facebook, Instagram, and Twitter with 20,000 likes on Facebook. A little bit of the audience and distribution. We really look for informed, health-conscious individuals. Patients have a recent health diagnosis such as cancer. Based on some of our search engine optimization, we noticed that there's a 1,000-fold increase in natural or alternatives therapy post a recent diagnosis on Google Trends, and that's essentially where we've gotten our customers from. You can see we've been in multiple different stores across the nation. Obviously, we've got plenty of IP, one patent. We got three additional patents applied for, and what I'd say is the most powerful IP is our mathematical model that will never be published, patented, and will remain a trade secret with our company forever. Now, it wouldn't be a bioscience investor conference if we didn't show a couple of slides of evidence. So what I want to talk to you is one of the compounds in our product is called fucoidin. It comes from seaweed. This is one fucoidin from one seaweed. Again, we have 3 different types of seaweed. This example is actually talking about fucoidin and its synergy with chemotherapy. Now, with all scientific articles, there's a lot of details. So let's take that out. Fucoidin is Fe, and then you'll see cisplatin, tamoxifen, paclitaxel were also used in this study. The study was used on breast cancer cell lines and really looking at 24 and 48-hour use and cancer cell death, if you will. Now that they really talked about its ability to synergize, if you will, which is a terrible word, but it's used in this study, with cisplatin, tamoxifen, and paclitaxel. Great destruction of cancer cells. What they don't talk about, however, is what fucoidin is doing by itself. Fucoidin alone is as effective, if not more effective, than cisplatin, tamoxifen, and paclitaxel. Now, the authors don't suggest that, largely because it's probably publishing pressure, but we notice it, and we've seen it in our patients when we start looking at our customers, when we start looking at the customer anecdotal reviews. Again, you'll see this time and time again. Switching on the mushroom, one of our mushrooms is Ganoderma lucidum, which is also known as reishi, also in our coffee and whiskey brands. Also, another story, erlotinib and Ganoderma, talking about synergy. When you look at the data, Ganoderma by itself is as effective, if not more effective, than this product, erlotinib. Last one, Ganoderma again with chemotherapy, this time with cisplatin. They're talking about how great it is to combine the both, which is great. However, if you look at Ganoderma by itself, it is a very successful chemotherapeutic based on the data as we have here. Last study, and we're taking it back a little bit in terms of the detail. At the end of the day, this was an epidemiology study done in 1969 in Japan. The epidemiology researcher had said Japan currently has the lowest cancer rates in the world, and it still stands today. But in '69, they were expecting a lot of tumors to come up because of the nuclear bombing in the 40s. However, they weren't seeing that, so they created this epidemiology study to understand why. They noticed that in all the prefectures in Japan, they were much lower than the rest of the world, but there was one prefecture that was statistically even lower than everyone else. Interestingly enough, this prefecture was really a company town. It was a farm, mushroom farm specifically, and everyone worked in the mushroom farm. And what was going on in this mushroom farm is the bad product, or the bad mushrooms, or bruised mushrooms, were given to families or the employees to take home. They were considered the defects. The good mushrooms were sent to the market. What was interesting about this study is, you'll see on the left-hand side is the cancer rates for these individuals in this prefecture. And the cancer death rates were 160 divided by 100,000 patients, so 160 out of 100,000 people. When you looked at the farmers growing this specific mushroom, you had about 97 out of 100,000. There's a statistically significant difference in 1969, and then this came in later on as you see some of the data from 1972 and 86. The original graph that you see here was repeated 4 more times. Originally in 1969, again in 1985, again in 1989, 2003, and 2010, all showing the same story, which even further supports trying to embed a daily regime of good food and highly potent food to help with cancers and related disease states such as viruses and reproduction, etc. So that's one of the things we wanted to show you as the last kind of research slide there. It's a really unique story across the board. Now, of all these slides we've shown you, much of it does require further research, which is essentially why we're here. But the initial results appear very promising. It takes us back to the really Alexander Fleming stories. They discovered penicillin, ironically from a fungus, by accident, and recognized the outcome for treatment of infections in 1928. And the amazing thing is that what was going on then pushed them to use this right away. They knew the outcome. They didn't know how it worked, but they knew the outcome. It was only 40 years later, in 1968, a formidable mechanism of action was proven. And we all know this today. Beta-lactam and penicillin breaks the 5-glycine bridge of cell wall synthesis. Today, it's still the most prescribed antibiotic in history. Now, for us, we're in that situation. Our products have a combined set of ingredients with mathematical model proving the evidence prior to getting into the customer's hands, with the customers ultimately validating the math and the opportunity driving us to a formal research evidence program. It's essentially what happened with Alexander Fleming back in 1928. The true mechanism, however, of our products may not be known for a very long time for any of their proposed immune-enhancing properties for anti-cancer, antiviral, etc. What we do know, however, is the outcome, just like Alexander Fleming, and that is safe and appears to work on differing levels for different people. We owe it to our patients to find a more effective and efficient therapy and increase overall general population health. We truly look forward to working with you guys. We can't thank you enough for having this opportunity to present our story. If you have any questions, feel free to reach out to us. You have our contact info on the investment sheet, and we wish you the best of luck. Thank you.